Welcome to State of Affairs. I'm Steve Adubato. We're coming to you from the Agnes Varus NJTV studio in beautiful Newark, New Jersey. It is my honor and pleasure to introduce Barry Ostrowsky, who's the President and Chief Executive Officer of RWJBarnabas Health. Barry, let's jump right into this. This is part of an ongoing series we're doing on the future of healthcare. The connection between RWJBarnabas Health, Rutgers, as it relates to cancer care. Talk about it.
Yeah, we're excited, of course, about our partnership with Rutgers. One of the things that Rutgers has is the state's only designated cancer center, which is the Rutgers Cancer Institute, which is located in New Brunswick. We've decided to take that Cancer Institute and spread it throughout our healthcare system so that every venue we have will have services that are generated by that Cancer Institute. The research will be done primarily in New Brunswick at a new home for the Cancer Institute that we're planning right now and will be constructed over the next number of years. And what most people don't know in New Jersey is that Cancer Institute is a world leader in something called precision medicine, where we're now treating patients with cancer using their own biological blood and other types of injections that we use, where we feed back to the patient that which they have. Best way to, in fact, will be the best way to treat many of these cancers. So that is the home of that kind of research. We also do clinical activity there, but the clinical activity throughout our system will in fact be linked to the great experts of the Cancer Institute.
In fact, that is why the question about the future of healthcare, because that is in fact part of the direction. And technology has a lot to do with it. Innovation has a lot to do with it.
Well, innovation and technology, and I have to tell you, Steve, the future of health in the United States, and we make a distinction between healthcare and health. Frankly, our mission is about the health of the community. Healthcare is frankly just vending healthcare services. We feel our mission is to enhance the health of all those that live in our communities. So there's really at least a dual-prong approach to that. You have to have a platform that's clinically based, that has academics, that has research, so that you can assure folks who live in the communities that they can access the best clinical care. But 3.5 million New Jerseyans, frankly, can't afford the basic needs of life. And that's food, and that's housing, and that's safe streets, all of the social determinants that frankly keep people sick. That combination will do best to help our communities be healthy. And that's what our new mission is. Not only the clinical side, but the social service side. Together, that's how you're going to get a healthier New Jersey.
Yeah, Barry talks about the social determinants of health. To fully disclose, RWJBarnabas Health is a major underwriter of what we do here on public television. But also, I've done some leadership coaching at your place, and this whole question of social determinants of health tied to social impact, what often, I don't question, but I want to understand more, and you can help our audience understand this. Social impact, why is it that a healthcare system is looking to have social impact as opposed to just healthcare impact?
Well, if you analyze what unfortunately makes people ill and what makes their lives less healthy and happy, it's 10% genetics, 30% clinical platform, that is physicians and hospitals, 60% is the lack of your basic lifestyle requirements. So if you can't get healthy food, if you live in substandard housing, if you're chronically unemployed.
Transportation you can't get?
If you can't get transportation, you live in a community that's unsafe, those items will make you sick. And so no matter how many doctors we put in the hospital, no matter how many surgeries we do, if we don't address those issues, we're not improving the health of the community. Now, historically, healthcare systems stayed with academics and clinical platform and research, and we do terrific things there, but we still look and we see our communities, particularly vulnerable communities, and we say, why aren't people healthier? Now, some of it means that people have to adopt better lifestyles voluntarily, but still, no matter how voluntarily you adopt a better lifestyle, if you don't have good food and you live in substandard housing and you can't get a job, you are not going to be healthy. And what happens, people who suffer from those social determinants tend to access the healthcare system on a regular basis.
Which drives cost.
Drives cost.
We're in Newark, and that's one of the communities.
No question about it. The vulnerable community in Newark is one that we're focusing on right now, but we do it in New Brunswick and Long Branch and others throughout our service area. And so if you look at healthcare and say, what makes it expensive in the United States, among the reasons is the fact that people who ordinarily could feel better with the right social platform are accessing conventional health care that makes the burden on healthcare systems both expensive and difficult to meet.
The other part of the future of healthcare is getting out there more. And one of the initiatives is called the WOW Van. It's Wellness on Wheels. Explain what it is and how, again, it is part of the future of healthcare.
So WOW, the WOW vehicle, which is an RV that we've had outfitted to deliver fresh food and to teach people in various vulnerable communities how to prepare that food, is really a throwback to when I grew up in Newark. My mother had a vegetable man that came down the street. She was able to go down from our 2.5 family house where we rented an apartment and buy fresh food. You can't do that nowadays, so we have recreated that by going into the vulnerable communities and delivering fresh food and teaching folks how to prepare it. We go to schools, we go to preschools, and it's been incredibly successful for us. Folks have embraced it. So here's the issue with social determinants. If you effectively say access to healthy food is a necessity, you're going to do something like this WOW vehicle, but you're only going to deal with ones and tens and hundreds of people, and you can't be frustrated by that. It's going to take generations to address effectively these social determinants, and you will see healthier generations in the future. The investment is not paid for, candidly, by any insurance program. Medicare or Medicaid doesn't have a code that says, let's pay for healthy food.
Should it?
Yeah, absolutely. But at this point, it doesn't. And so what we've decided is to take some of the resources that we've accumulated by vending healthcare services and apply those resources to these social determinants.
Before I let you out of here, Barry, the other initiative, Rutgers is very much involved, RWJBarnabas Health, Rutgers Connection. The Rutgers, RWJBarnabas Health Athletic Performance Center, opening this summer in 2019. What is it, and why involved with Rutgers in that way? Athletics.
Right. Well, we think that we need to make a contribution to the general society of New Jersey. Rutgers is our state institution. We believe in supporting things that are New Jersey. And when we spoke to Rutgers about its needs to, in fact, make itself better for various types of students, we've invested in the medical school, we've invested in other professional schools. This was our opportunity to invest helping student athletes who in fact needed better facilities, and we're so excited about it. And the truth is, all of this is a contribution, in our view, to making the lives of New Jerseyans better. And of course, these athletes in many cases come from other states, and we want to put our best foot forward to ensure that folks have the kind of feeling about New Jersey that many of us have, having been born and grown up here. So we're excited about that, and in fact, I think when it opens, people will see a state-of-the-art facility for student athletes.
And by the way, in that spirit of giving back, let me just repeat what I said before if you missed it earlier. RWJBarnabas Health is a significant underwriter of the work that we do at the Caucus Educational Corporation, a supporter of public broadcasting. Thank you, Barry.
Thank you so much, Steve.
Well done.
Appreciate it.
This is State of Affairs. We're at NJTV Studios in Newark. We'll be right back right after this.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 30 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by the Turl Fund, supporting right from the start NJ, the Robert Wood Johnson Foundation, the New Jersey Education Association, NJM Insurance Group, Berkeley College, Wells Fargo, and by Summit Medical Group,